Hello, dear guests. Thank you for coming. Given the time of the year, we were expecting that many of you would be on vacation, but apparently there is lots of interest about digital health. And today we have an interesting speaker coming from the United Kingdom, Professor Robert Stefanian. Thank you for allocating time from your busy schedule to share with our audience your knowledge and expertise on this field. That we have had some projects in Armenia and we are moving forward with e-health issues. But it's interesting to listen to you as an expert who works for international organizations to see what would be your advice for Armenia. So before we start the presentation, I would like to say a few words about our speaker. Professor Stefanian is an honorary visiting professor at the Institute of Global Health Innovation in Imperial College London. You probably remember Ara Darzi, who is heading this institute. So Professor Stefanian is recognized as one of the leading authorities and pioneer of mobile healthcare, and one of the first scientists to have coined and defined the concept of mHealth. He is a WHO expert advisor on their guideline development group for digital health interventions. He has held several senior academic and research posts in the United Kingdom and Canada. This includes professorship of data communications for healthcare and the founding director of the Medical Information and Network Technologies Research Center at Kingston University, London. He was a visiting professor at St. George's Medical School, University of London, and distinguished visiting fellow at the Center for Global E-Health Innovation, University of Toronto. He also held senior lectureship in the universities of Portsmouth and Brunel University, United Kingdom, and associate professor at Ryerson University, Toronto, with adjunct professorship at the Western University, Ontario, Canada. He served as an expert on numerous assessments, peer evaluation panels on digital and mobile healthcare and innovation technology in the UK, Holland, Finland, Ireland, Canada, and other countries. And he also authored over 200 peer-reviewed publications, conference papers, and books, including the recent book publication on mobile health, published by John Wiley Press in 2017. So, Professor, it's our pleasure.
Thank you for the AUA and Dr. Hartman for the very short notice I gave on the lecture. I thought this is a very important topic that I'm actually evangelizing this throughout the globe. So whenever I go, I give talk, but I think it is most important that I talk about it in Hayastan. So, Shunagaling Hargaf, I mean, Cherikaras, Amarov. I will try to speak half higher end, half Ankeren, after Masopare, Tijvare. So let's start with the how. Basically, the title, I chose it because it's important that digital and mobile health will improve both the healthcare delivery and the economy as well. Maybe people doesn't know about this. So my talk is going to be what is digital or mobile health, including mobile health, and the recent big-time interest of the WHO on digital health interventions, and then I'll talk about the science of mHealth and the clinical areas based on the WHO interventions that they published recently, and then about global market of digital health and mobile health, and how we can establish a digital health economy in Armenia. So what are the opportunities and the challenges? And then I will give one clinical example of that is I've been working the last 15 years, which is in digital diabetes area. And then I give some conclusion and future suggestions. So where does it start? Let's start with mobile health or mHealth. So the starting was really more than nearly 20 years ago, but in 2003 I wrote a very seminal paper about mobile health, where actually it was the first time that the word mobile health or mHealth was mentioned. And in 2004 I translated that paper and co-wrote it to other colleagues in the famous editorial. So it was, and we defined it, that one, mobile computing, medical sensors, and communication technologies for healthcare. So very simple definition. The WHO, after 8 years, they put their definition, which is medical and public health practice supported by mobile devices such as mobile phones, patient monitoring devices, personal digital assistants, and other wireless devices. So it took about 8 years when they saw that it is, during that period, it became very, very prominent, in both clinically and academically. So this shows, this slide shows the timeline between the establishment of the first mobile phone by Motorola in '73, and then, of course, I guess everyone remembers the famous Nokia 3310, and of course the Blackberries. And during that time, it was when I really started writing the first papers, 2003, 2004. But I think the milestone that happens, importantly, is when Steve Jobs in early 2007 introduced the smartphone. Everything changed, including the mobile health. But before he published, a year before that, I published the first book on the topic. The first book ever published on, it's a heavy book. I can send it to the university later. It's online, I think, now. And then, really, the area went very, very popular globally as a science, more of a market-driven economy. And then in 2007, I published the second book, which is the first textbook. It's the first textbook that is written about the topic, which is now taught in many different universities. Now, this is the book. There's a confusion about the term. I discussed this in the book about what is telemedicine, what is e-health, what is telehealth, what is mHealth. So basically, telemedicine is the first. So these are the 4 pillars of ICT for healthcare, i.e., information health technology for healthcare. These are the 4 pillars. So the telemedicine is the oldest one, which is basically a practice of medicine remotely. So 2 doctors or the doctor-patient on a computer, and goes back to the 60s. And then in 1978, at that time, the telehealth appeared, which is basically providing healthcare remotely. It's not consultation, but providing the healthcare to the patient remotely. And then around 2000, when the internet really kicked off, the e-health started basically with the internet. So and then progressed into, which is now currently about electronic patient records, electronic health records. So that was the time. And in 2003, the mHealth, was first introduced from my work. But of course, there is a change. A major leap in mHealth is that in 2007, the smartphone came in and everything started really. So very recently, the term digital health came, which is basically including this whole areas, but mostly really it including mHealth with areas of advances like genomics, artificial intelligence, and big data. So more of the engineering and computing, and now these areas, as you know, genomics, but now artificial intelligence, deep learning is the big, they are calling it the next revolution. So integrating these within mHealth, they are calling it digital health, including the WHO. So in 2011, it was at the peak, you know, like the Secretary of Health in the US at the time, she was lady named Kathleen Sebelius. She said that mobile health is the biggest technology breakthrough of our time. So there was a summit, which still now goes in Washington every year. And now they call it, of course, Connected Health Conference. And there are now even special conferences on the clinical aspects and the trials of mobile health. So, and there are, of course, European alliances and so why mHealth and digital health? Why this big thing? You know, because it has multifaceted benefits. From the clinical and the healthcare aspects, it provides improved delivery of care, especially in, for example, in countries like Hayastan, in remote areas, in our South region, where really we have less timely interventions and early diagnosis. So that's the key thing. And then, of course, there's a patient empowerment, so what they call or patient-centric care, which is basically giving the patient the role of how he improves his management of his disease condition. And particularly, this is very important in chronic diseases, you know, cardiovascular, diabetes, cancer, etc. And of course, most importantly for Hayastan, is it reduces the healthcare inequality. So it provides a very cost-effective way of providing specialist care with reduced cost or no cost by utilizing an existing infrastructure, which is a smartphone. So I didn't have statistics about, but I think the penetration of smartphone users, especially among youngsters, is very high in Armenia. And also, most importantly, research, it's an enabler for clinical research, further research, evidence-based, and that is very important by, again, an existing infrastructure. And also from the educational side, improving medical education, and it's the way that's the next digital, what they call the next digital doctors and nurses. Training them about these. And most importantly, the other, this is more or less on the clinical and scientific aspects, but most importantly on the market economy. It's worldwide, it's a multi-billion dollar, reaching 40, 50 billion market. So it's a job creation opportunity for SMEs, for innovators, and so forth. So this is a slide that's showing the growth of the global market in digital and mobile health in this year and last year. So as you can see, the figures are exceeding the 20 billion. Mostly, I will show that this market is driven by United States and European market. Now, to some extent, China also now. So the big FTSE 100, they are all into the business of mobile health and digital health. Google, of course, is now one of the leading ones. Microsoft, most of the pharmaceuticals. But the most important thing for the economy of Armenia is actually the SMEs, creating SMEs, entrepreneurs. So this is an example of a landscape of all the SMEs, some of the SMEs successful, into the different areas of digital health. So for example, in medical devices, in electronic health record, electronic patient engagement, telehealth, remote monitoring, I don't know if you know, Internet of Things, big data, population health, clinical, and so forth. So these are all the areas that encompasses mobile health and digital health, and they are mostly startups, but they got big investment, and they are becoming, very globally influential companies. And you can see this graph, the increase in the publications versus the investment of mobile health. So the investment level is we are talking in billions, but still the publications, of course, because they are publications, but they are on the increase. So in a one review paper from 2006 2016, so a decade, there was around 5,500 papers or documents published about mobile health, not digital health, mobile health, and which is an average of 500 publication per year, which is still amazing, considering it's only a 15-year-old topic. Now, I think the most transformative thing clinically and medically will happen from this year onward. Why? Because in the WHO, the World Health Meeting in May in Geneva, they put a statement on mHealth, as you can read it at its 139th session, that recommending mobile and digital health for the member states. So this is a big leap for mobile health. And currently, as we speak, the WHO is in the preparation of preparing guidelines for the digital health interventions that will be recommended for all the member states. And of course, I'm privileged to be one of the experts working on that. In April, the WHO published the classification of the digital health interventions, the first version, which they categorized the classification into 4 major areas about clients, healthcare providers, health system managers, and data services. So these are the 4 pillars that the digital health intervention and the guidelines that are going to come are based on. So these are available on the website. This is the link that you can download and read about it. So for example, for the clients, they divided it into 7 areas, from targeted client communications to untargeted client communications to client-to-client communication to personal health tracking, citizen-based reporting, on-demand information services, and client financial transactions. The ones in the red is the ones that are included in the forthcoming guidelines. And for the healthcare providers, again, they subdivided it into like client health records, health provider decision support, telemedicine, health provider training, referral coordination, and so forth. Oh, I forgot to mention that actually the Human Reproduction Program within the WHO is responsible for these guidelines, preparation of the guidelines. And for health system managers, these are the subcategories that they are to be included within the guidelines. Supply chain management, like managing inventory in hospitals, notify the stock levels of medicines. Very important for Armenia, areas like civil registration and vital statistics like notification of births and deaths and so forth. And the 4th one is the data services, which are these areas about the data collection and location marking, but these will not be included in the forthcoming guidelines. So,
do you know why?
It's complex. Because all the guidelines are based on evidence-based. And so far, in that area, there isn't enough evidence-based. It's just moving. That's one of the things, yeah. Because the guidelines are discussions part of the evidence-based, clinical evidence-based. Now, from the global health perspective, and I mentioned this in my book, it's you can see a lot of the countries have initiatives, a lot of initiatives targeting the 4 MDGs, which were reducing, which are related to mobile health, reducing child mortality, improving maternal health, and combating infection diseases. And these are some of the initiatives that have been carried out in the last 10 years in different countries like India, Africa, and Tanzania, and so forth. And you can see that there is a major initiatives, particularly in African and in Indian subcontinent. So global examples of mobile health, so many. I mean, there are hundreds, if not thousands, of applications. But these are some of them, like population scale measurement of physical activity. Very simple device with accelerometers that you can measure low-cost human motion, and by that you can measure the activity, level of activity, and the weight, which is very important for reducing, for example, obesity and thus prevalence of diabetes. This is another example. It was a big project in South Africa called MAMA that was even funded by the Clinton Foundation about prenatal health, and also another project about educating patients with HIV and AIDS. I think from my perspective there is a problem of sustainability of these, or what we call piloticis. So most of these projects have during pilots, a year or whatever, and then after that, what I call the stickiness factor. So this has to be sustainable for years and years. This was lacking. And another important area which is very successful in mobile health is chronic disease management. So I will discuss this in more detail when I talk about the diabetes later. But of course, there's a lot of programs and applications, or as you know, apps, thousands, tens of thousands maybe, in different areas like alcohol dependency, smoking cessation, asthma. All these are important areas where really there's a clear evidence of improving healthcare. I put these examples of some of the areas that really mobile health can be applied very successfully in Hayastan, from wellness monitoring to chronic disease management to early diagnosis. And these can be done really with a very cost-effective solutions, not much. So these are all opportunities for universities to work with entrepreneurs and create new opportunities for the economy and the market in the country. So this is a very interesting map showing the major countries around the world that are big in the mobile health and digital health area. But you can see the region where we are. I put it in the dotted. This not much. But what caught my attention is two countries that are relatively small, but so focused on innovation, and particularly digital health innovation. So I'm going to talk about Israel and Singapore. So this is a WHO statistics, health statistics of Armenia versus Israel and Singapore. So of course from this you can see that our expenditure is much lower, healthcare per GDP is much lower than what is in Israel and in Singapore. And for example, in Singapore, the population is roughly double the population, but the area is smaller. Israel, again, they are about 4 times, but the area is maybe relatively similar to Armenia. Now, why I chose Singapore? Because about 10 years ago, if anyone visited, they have the oldest Armenian church. The oldest Armenian church built in 1835. And they're part of their heritage. And of course their GDP is very high, as you can see. But they are now one of the most advanced countries in terms of innovation and technological innovation and research, and they have 2 universities in the top 50 universities, or is it top 40? And they, of course, built, I think 11 years ago, a national e-health highway, system for everyone. And more recently, they decided, identified these areas: cancer, cardiovascular disease, diabetes, malicious infectious diseases, neurological and sensing disorders, as their target therapeutic areas where they need to focus the research. And they announced a $13 billion 5-year plan for development of innovation technologies and the intersection between advancing technologies and healthcare in these areas. And mostly, of course, it's based on homegrown companies and major companies like IBM and Philips. And the second one, of course, is the second country I want also to make comparison with Israel. Israel is actually one of the most active countries globally, not only in the Middle East, in mobile health, and they have every year a mobile health conference. They call it mHealth Israel. And they sprung every year tens of startups. Some of them become extremely successful. I don't have the time to, but you can see them at the... And they are very recently investing $300 million on disruptive health technologies. And of course, as you know, it's Jerusalem, and one of the oldest Armenian cathedrals is in Israel. Now, examples more to our part of Europe is from UK. In April 2018, the Imperial College and the IGHI, led by Professor Lord Aradersi, established the first NHS Digital Academy, which enrolled the first cohort of the future digital health managers and experts. So it's a 1-year program, it's online, and it's a collaborative initiative between IGHI, Imperial College, and University of Edinburgh and Harvard Medical School. So they are going to basically train these clinical information officers and chief clinical information commissioning officers about all aspects of digital health. And for these to be the leader to transform, because the idea is in UK they would like to transform the NHS into, and now there is a part of the NHS, they call it digital NHS, which they are going to move very quickly to adapting digital technologies to improve different healthcare outcomes. The second example is from Europe, from Netherlands. I read it very recently about this. It's called Springhouse area. So this area in Amsterdam, it seems years ago, it was very derelict, poor area, and then some independent Dutch curator, with the support of the Amsterdam Economic Board, completely changed the area and established this co-working space, where actually all the innovators in Amsterdam are combining to produce new solutions, including in digital health, with the aim that by 2020, or is it 2025, Amsterdam will become Europe's top 3 destination for innovation. That's one of the aims. So this is another example. And these are, why I'm mentioning this, because these can be an exemplars that we can do this in Yerevan, for example, or in Artsakh, that we get a derelict area and we inject some money from entrepreneur and convert this into a co-working space for innovators to produce these new solutions. Now, talking about going to business models, the stakeholders, mainly in any model, digital health or mHealth is, of course, the users. The Americans call it user, they don't call it patients, which is a bit interesting. But of course, it means the patients or the users because they pay. And the healthcare providers, i.e. the clinicians and the nurses, and the business and the finance enterprises, banks, and the insurers, etc. And of course the innovators, the technology innovators. So, and most importantly, the governments, or in this case I call it the policy and the regulatory bodies, which is the government. So these are the stakeholders in any model you want to put successfully. Now, this will be interesting from the business school to study a suitable model or suitable models for Armenia. Because now there is no fixed model anywhere. You know, you cannot produce a model in the US and you can apply it in let's say in the Gulf or whatever. So it has to be home. Now this is the other area which it is very important that I talk is digital health. Is it in Armenia should be evolution or revolution? So this message is really to the government. These statements I'm putting is as much as to the clinicians and the universities, but also to the policymakers and the government, Armenian government officials to discuss this. We know, for example, for any high-performance organization, if it's established, it has to have these important elements into it to be successful: the strategy, people and leadership, the process and the design of that process, the management and cultural engagement. So these combined, they provide the successful high-performance mHealth initiative. And this has to be looked at very carefully for Armenia, for any really big governmental initiative to be successful. These are some of the points that I thought there are some of the factors, there's complex factors for Armenia that inhibit a progressive implementation of digital and mobile health in Armenia, and these are of course subject to discussions. So there is no digital health policy in place in the country. There is the cultural and the population barriers. There's a lot of the population in Armenia that they just don't believe in this. They are not trained. And the lack of adequate voluntary healthcare system support. For example, there is no voluntary contribution to the healthcare. Anyone can contribute to the means, and the government can add on it to provide a healthcare fund. So these are issues need to be addressed. And of course, most importantly, is the lack of digital health leaders in the country. And this is part of the education, where that's why I mentioned the example of the Digital Health Academy. It will be fantastic if there is such a system or such a academy, or not academy, or a course established in Hayastan. So I nearly finished my talk about talking a clinical exemplar about digital health, very, very successful globally, is in the diabetes area. Now, you know that diabetes, once you are diabetic for life. And one of the pillars of controlling your diabetes, your blood glucose, and preventing your hypoglycemic events or cardiovascular risks, strokes, and things like that, is self-management. So in 2007, when the smartphone started, one of the first areas of application that really the innovators started is in diabetes area. So now there is more than, I think, 2,000 applications on diabetes, but very, very few that are successful, mostly in the USA. Now, I don't want to go to the benefits of the digital or mobile health for diabetes management, but some of the advantages is that it brings this feedback loop. So the feedback loop between the patient and the clinician, by getting the data and the nutrition and the exercise, transferring it via smartphone or cloud, and then the clinician or the nurse can then look and prioritize the care of the patients, especially the patients who've been diabetic for a very long time, and provide a timely intervention, of course. For example, if the patient is not taking blood pressure, readings, and he is really very hypoglycemic, prone to very hypoglycemic events, it's very, very important system like this so timely intervention, cost effectiveness, because everyone has a smartphone, getting the data. And most importantly, I think for Hayastan, it's actually understanding how many people are diabetic, how many people are hypertensive, how many people are prone to stroke. And this is very, very important. So what we have done from a system that I led a small team of innovators, I advised them, we produced one of the first global diabetic culturally agnostic multilingual system. They developed a very clever device that connects to any glucose meter or blood pressure or continuous glucose meter seamlessly. Because you know that there is about 70 or 80 of these devices, from $5 to $100. So of course for Hayastan, we prefer the $5 with $2 strip rather than the expensive ones. So this is the world first, it's called Mufid, and it's a world first multilingual. Now the first edition will be English and Arabic, but we can add other languages that connects to any and send the data from any blood glucose device or a blood pressure or continuous glucose meter, Fitbit, to a secure server and an electronic patient record that is tailored for the clinical management. So this is the device. It's a very small, it's a very low power. It's an effort of a 5-year engineering. This is a very how I call part of an Armenian innovation.
Valuable.
Yeah, very high innovation. The app, of course, it has 5 major elements of disease management, which is blood glucose, exercise, diet, medication reminders, and many others. And this is a snapshot of the app. The major. I would like to give a demo, but unfortunately my bags were lost. I had the system here, and this is the website of it. They are going to release it, I think, in September, October. First, it will be probably applied to the Gulf area, and then we hopefully will see how it goes. So finally.
So this application doesn't work yet? Is this a new application?
Yeah, it's a new, but they are going to release it very soon. And one of the things I would like to propose is that we do a clinical trial, training 20 nurses. They go everywhere across the provinces of Hayastan with one of these devices, with cheap glucose meters, and collect the data. So through, let's say, 2 months, we will know, maybe on national level, how many diabetic, how many hypertensive, with a very cost-effective solution. So that you don't need really to build an national electronic and spend millions and millions. And this was when I was talking about people talking to so the key thing from what I talked is the different areas of innovation. This is one. If I speak, like ultrasound scanning, other similar apps for COPD patients. There is now a major movement into using the smart apps with behavioral change. So change the behavior for smoking cessation. People stop smoking, so they don't get cancer, I think. So there's all these are driven by small innovators, but in collaboration with the universities. So it will be very, very successful model if the universities like the AUA or the the medical university in Yerevan to work with these incubators from homegrown entrepreneurs to make successful digital health economy within the country, and so it brings jobs, creates very like what is happening in the US, UK, and the two countries I just mentioned. So finally, I think these are my thoughts about the plan of action of digital health for Armenia. I think the first thing is to introduce really a governmental body that will look at how, what is the best digital health strategy and policy for Hayastan. I think that's the first thing, and this is really my message to the decision makers, to the politicians. And then once this is done, is to find the best national digital health fund and plan for implementing the critical services that are targeting for Armenians through, I think, because the government cannot do much, it has to be through private public partnership, PPPs. And then a 5-year digital health initiative for once these are done, then a 5-year to the most urgent public health and disease problems in Armenia. The other very important solution, as I mentioned, is to establish a digital health postgraduate program for training the next generation of digital doctors, nurses, and healthcare providers, managers. Because this is the future, and this is part of the mission I'm talking about, is that this is the future of healthcare. So you will listen to it now, or you listen to it, why don't you do it now rather than you look at it 5 years from now. And of course, the most important thing is to have, as part of that governmental digital health plan, is to have a digital health economy, sustainable digital health economy, through creating these innovation zones, subsidized spaces, to encourage entrepreneurs and small to medium-sized businesses. Like the one I mentioned in the example in Amsterdam, for a very cheap location in Yerevan or even in Artsakh. That's all. So I would like to thank you all for listening, and I'm happy to give answer any questions you have. Thank you very much. Yes, please.
A couple of questions. One is about what you said about medical education.
Yes.
Already a lot of people, physicians in training, nurses in training, are very comfortable using, searching the internet and just getting information from YouTube, Wikipedia. The older people in medicine resist that because they think it's very difficult to find good versus poor, separating the good and the poor information. So my question for you on that is, where do you see the role of medical educators in curating information so the students are getting the good, not the bad information? So that's one, and I can repeat that later. But the second question I have for you is, where do you see in the innovation cycle people like you working in England versus people here developing technologies? Wouldn't you want, from the patient standpoint, wouldn't it be easier for people to just copy technologies after they are invented? From the economic standpoint, I understand you would want them to innovate everywhere. But from the patient standpoint, it doesn't matter where it's coming from. You can copy later and make it much cheaper. It's there, and so just use it. So where do you see Armenia and similar countries taking the lead in innovation versus just copying what's there, or just using what's there?
Yeah, thank you for these questions. I think for the first question, really, the educate. First of all, let's start something on digital health. There isn't anything, and I think the example of the online, the Imperial one, is a very good example to establish a course, a postgraduate course, and I'm sure myself and Lord Darzi will be very interesting to hear if there's anything that, but the decision has to be made from here, you know, in Armenia, to say, okay, we are interested. And then once you create these digital leaders, then these will be the people who are going to, you know, optimize the information that you mentioned, and design the best methodologies that will optimize the care, for example, for 20-year-old versus 70 or 80 years old, because it's not a simple thing like that, especially you know, for Armenia, because a lot of the elderly or even over 60, in a matter of fact, there's a confusion, because some of the research area we found that people over 60 are more inclined to read about digital health and, you know, on the phone and look at their disease condition rather than the 20-year-old, 18-year-olds. So that's the first part. The second, for the second part, sorry, I forgot.
So the question was, why should everybody be innovating? Why shouldn't we just copy and use cheaply whatever is made by you and people?
Yeah, but can you copy? That's it. Can you copy? That's one thing. It's not easy copying. I mean, reverse engineering is easy to be done, but by the time you do it, you will have a lot of capital and effort to put that. So one of the things where actually it is important for Armenia is to have the incubators or the small businesses to have much lower cost compared to for example, I give you an example, a very good programmer, iOS programmer in America, it takes about $160 per hour or something like that. While in India, he can do it for maybe $20 or $30. So in Hayastan, he has to be competitive with the person in India, not he say, in America, I would like to take $160. That doesn't work. So this is very important. I think the economic factor and the control of how these small businesses will succeed in more economic terms is very, very important for their long-term sustainability. But you are right in terms of that, I call it frugal mobile health systems. Frugal, so the most cost-effective solutions. And these are, why it is, for me, I think because in Hayastan there is a lot of very clever programmers, mathematicians. For example, one of the areas where I think it will really kick off is in artificial intelligence and in big data analytics, not necessarily on the engineering side. Engineering, yes, it can be done, but more into this area. And that's one of the things where I suggest that, you know, the young graduates focus on that, so that they can build businesses here. Why they immigrate to Russia or Europe and things.
Can I ask a related question? So for diabetes, you said there are thousands of apps, 2,000 is the number you mentioned. What would an app from here, what would make it stand out? Is it some kind of endorsement from an accreditation body, maybe from WHO, that would say this is a great app to use, these apps are not so good? So how would an app that is really developed for an area which is already overcrowded, what would make it stand out? What would make it used rather than something else? No,
in diabetes, I think it's the real question is because diabetes is so now mature, you know, it's so competitive and mature. I don't think that this question is valid for the diabetes, because now, for example, one of the things where I would like to see is an app tailored in the Armenian language. Very simple. There's no, and that's why our app is the app that I mentioned is multilingual, so it can be easily translated to the Armenian and used by Armenian in Armenian language. Why I bring an app which is in English to translate it and take time and effort? Yeah. And the second thing, the other thing is has to be culturally agnostic. So it means that, for example, and that's why important for these, what I propose, you know, about training and doing a pilot across the country to understand what are the cultural sensitivities and the requirements that this app can then be modified. But there are areas where actually untapped. So what I am calling now is really for the innovators to untap areas that are specific to Armenian healthcare problems, but they are untapped in places like US or Europe or the areas that I mentioned.
Robert,
Rachi.
Shadura.
Yeah,
I'm really very glad that you're here,
thank you.
and I think the Mufid is the one of the innovation that you've done, right?
Yes, yes, I led this, yes.
Yeah.
With a very, by the way, it took 5 years we've been working
Yeah,
on this.
I'm very well aware of everything, all the details, and in fact, I wanted to take your time after this meeting to introduce you to other people.
Sure.
In regard to mHealth and small businesses, I think we're in the infancy. We are doing a lot of our youth are working on starting small businesses in the health area, in the especially digital health management, following frugal innovation processes as well as disruptive innovation processes. So we're not in despair. We have talent. We have a lot of our graduates from AUA as well as from other universities, even from our medical school. They do engage in starting small businesses. So we're on the right track in that sense. So no, however, in terms of the impact, will be there, I would say, from my research point of view on entrepreneurship. You're going to be hearing a lot of them in a few years' time, which I will give maximum 5 years, no more. By the 5th year, you will see a lot of new businesses coming out of Armenia in the digital health area. Now, where do you see yourself in the research that you're going?
I'm now, so yeah.
Regard whether the digital health goes into the mHealth or it goes into the entire AI or and where do you see the digital health going?
Yes, thank you, Rachi. I just remembered, when I came to England in 1990, one of the first people I met was Rachi, when she was working in Imperial. Yeah. So, for me, I'm now sort of evangelist. I'm just evangelizing mobile health all around. I would like really, and what better, يشهد ربي لذلك men's family Hayastani mensch, very big initiative, and I think we will eventually have support of influential people like Lord Darzi, because I'm sure he supports that. The things, what I mentioned is, for example, the government has to have, the first step is the government has to have a policy, a digital health policy, which there isn't. So one of the things that I would like to encourage the AUA maybe to lead, or in collaboration with the state university, medical university, is to really advise the government to say, okay, let's sit down, bring experts, Armenian experts from the globe to sit down to set up a digital health policy for Hayastan, for Armenia. This is the first thing I would like to see. The second thing, I also like to see a plan. Part of that is that the government supports these initiatives for the Armenian healthcare system, which, by the way, is not big anyhow, but it will be for us fulfilling, but for the market, Russian market, Eastern European market, global market, everywhere. And that's very important. So these has to be really systematically put into a framework that the government will support. And for example, I don't know, I heard there are, small businesses here and there, but not much. Maybe we hope that within the next, and this is what part of this lecture is to say, encourage them to start and I'm very happy to work with these small businesses. But they have also to mention what I mentioned there. They have to be working not in the mind that, oh, I develop an app at the same rate. For example, if someone says, if I come and say, in a matter of fact, as an experience, I tried to hire Armenian app developers, and they say, oh, actually, I'll charge you 100, same American one. I say, come on. So that's another thing. It's again the cultural change. You know, both for the clinicians also, and that's the challenge for the medical schools in Hayastan to more propagate this future, to train the clinicians, because any company in this domain will not be successful because there are 2 or 3 arms, is the computing, engineering, and the clinician. In a matter of fact, most of the successful companies that I've seen, the small ones, are driven by clinicians, not by innovators. So if the clinicians, the more we have clinicians, digital health clinicians and doctors are keen to provide this, the more we'll be successful, and the slope will be higher and faster to success.
No, I think we are, and Armenia is moving towards that direction. And after this meeting, we get to meet because there are some people I'd like to introduce you. And
Sure, I'm free. Yes.
Yeah. Thank you, Mr. Stepanyan, for the very interesting lecture. My name is Geran. Allow me, please, to make a few remarks, suggest something, and ask a question. In your one of the first slides, which are very difficult to see from here actually, why M health? No, it's okay. I think you are missing the health promotion, but it was mentioned on later slides. And I think that's an area which is probably often being missed, especially if the thoughts going towards medicalization. And I think today e-health is really becoming also commercialized in the promotion side. Then second, I would like to say that you are really evangelists because you're not talking about possible risks of digital health and potential negative sides, which also can be considered, should be considered, that are like the loss of the human touch, issues related to the medical confidentiality, pollution of the information because of the lack of control over the correct information. Then suggestion, in the situation when your first recommendation is that the state has to make the first step, I would suggest that the first step is done by us, by the American university, or by you, by creating a forum. Because in fact there are a lot of things done in Armenia. For example, as mentioned, there are activities in the AUA. I've heard also there was a kind of a research or project writing in Slavonic University. A small fragment from my visits to the regions. A diaspora organization provided a computer to one of the remote hospitals, allowing them to contact the specialists abroad anytime. And during 1 year, not a single doctor approached the computer to tap on it and to ask a question to a colleague. So there are a lot of things, small things maybe, going around, but probably by consolidating all these things and creating a group of interest that would lobby for your first step would be an efficient step. And then the last question, you mentioned economic side in your the title. What do you consider the most cost-effective first intervention in Armenia in digital health that could promote the idea amongst the authorities and in the public, and also economically be beneficial for the state or for the private initiative? Thank you.
Thank you for the multiple questions. What do I say? I mean,
Remarks.
yeah, they are remarks, yes. Some of them, actually prevention is very important. Prevention, yes. I think I was talking with Dr. Waki about the prevention. It's very important, and that's because, as I put in the slides, so many things you have to put and you can't put them in less than 40 slides. Prevention is very, very important, and I think it is a very important element. But the prevention, they have been talking about it for the last 15 years, using mobile health. Now they realize that actually it's not only the technology is part of it, but it is behavioral change. And this is, I don't know if the AUA has a psychology department, because it's very, very important is how you change behavior of the people to adapt to, for example, smoking cessation, to better manage their diabetes, to better manage their medication for cancer, to better. And they realize that behavioral change models and adapting the best behavioral change model is very, very important. So that's an area for innovation, by the way. So if there's any innovators thinking about this, this is a very good area. The second area, you are right, and this is another big area, huge area, is security. And as you know now, we are all in the news about. I just remembered now. Have you read that? I think a few weeks ago, I think 2 or 3 million data of users of the Singapore National Electronic Patient Record has been hacked. So that's one of the disadvantages of doing a national e-health in one place, because it will be eventually hacked. And that's another innovation area, is security in mobile health. That's a very, very important area to look at. Sorry, did I miss anything?
The forum.
Forum. Yeah, that's a very good suggestion. What I suggest, in order to not, because every 2 years we have the medical meeting, 2 years in Yerevan and 2 years somewhere outside, in the medical world, Armenian Medical World Congress, which was last year in Argentina.
Mm-hmm.
So I suggest the next one, which is I guess in Yerevan next year, to maybe the AUA to say, let's do a digital health forum within that meeting, where we bring the experts, and from there is the first step, because organizing the forum needs really a lot of effort. It needs, funding. It needs the committee. It needs the place. So funding is because I was talking to the people who organized the 2013 Los Angeles Armenian World Congress and the Argentinian last year. It's not an easy thing. I know the forum will be much smaller, but I think, considering to start with is to be embedded within the next Armenian Medical Congress. That's the first one. And I'll be happy, of course, to start the ball rolling. More than happy. Yes.
First of all, I would like to thank for your presentation. I think in future, e-health is going to make a big change in the global health. But I think you have answered for this question, but I would like to ask again, I would like to know how the data of the individual are going to be protected, and what are the current steps taken towards it in terms of policy. So do you believe that people with different kind of disease will share their personal information in online?
Sorry, I didn't follow the question. It's about the policies?
Yeah, I would like to know about the policies.
Policies where? In here? I mean, in Armenia, there is no policy. That's what I'm saying.
Not in globally. What are the policies taken to protect the data of the individual?
You are talking about the security and privacy issues. Yes, this is a major topic of the discussion ongoing. But asking the question is that,
do you think people believe? Do you believe that people with different kind of disease will share their personal information in online?
Yes, I think so. Because you know why? Because the WHO now is putting a guideline for digital intervention. Digital guidelines for all the member states to adopt them, including personal information. You know, I mean, not to, but in a secure way, as much as possible. Well, in our age, there is nothing called 100% secure. But because now, for example, one of the things, you save the data in cloud. And for example, in England, you cannot save in the NHS, you cannot save the data in the NHS except the cloud that is certified that the servers are in the UK.
That's right.
Because of security. You know, they don't want to do it in Amazon where he's putting his server, I don't know where, in Guinea or whatever, whoever. So to, yeah.
Okay, thank you.
So it has to be, for example, in Hayastan, the servers, the cloud servers for any data in the future has to be in Hayastan itself.
Շնորհակալություն ձեր շատ հաճելի եւ ոնց որ միշտ էֆեկտիվ հաղորդման առումով ուրախ եի լսելու ձեզ նորից ուզում եմ միջացնեմ որ 5 տարի առաջ հանդիպել ենք Լոս Անջելեսի հայ բժիշկների կոնգրեսի ժամանակ եւ նմանատիպ դուք լավ էլի ելույթ ունեցաք օգտվելով առիթից ես ուզում եմ որպես ինչ տարի դուք արդեն նշեցիք, պետք է լինի Հայաստանում, Երևանում անցկացվելու համապատասխան հաջորդ հայ բժիշկների միջազգային կոնգրեսը, ես որպես օրգկոմիտեի անդամ, օֆիցիալ ուզում եմ ձեզ օգտվել առիթից, ձեզ հրավիրել մյուս տարի ժամանել Երևան եւ նմանատիպ ունենաք բժիշկ Ավակյան, իրար ծանոթ ենք Բժշկական Երևանի բժշկական համալսարան, այո։ Երկրորդը ես ուզում էի ներկայացնել եւ իմ խոսայի իմ գոլեգայի հետ միասին պրոֆեսոր Կիրակոսյանին, որի հետ մենք հիմա ինքը ներկայացնում է Երևանի պոլիտեխնիկ ինստիտուտը, արդեն մի քանի տարի աշխատում ենք եւ հեռաբժշկության առումով եւ M-Mobile ունենք մի քանի արդեն արված աշխատանքներ, մի աշխատանքի հետ դուք ծանոթացաք, հանձինս հիմա մենք անցկացնում ենք հետազոտություններ եւ ծրագրեր կապված դիաբետի հետ եւ շատ ուրախ կլինենք, եթե կարողանաք այս օրերին ժամանել մեր կենտրոնը, որ մենք ձեզ ավելի մանրամասն ներկայացնենք, ծրագիրը անցկացնում ենք արդեն մի քանի տարի առաջ, մի քանի տարի է եւ մի քանի տարի առաջ մենք սկսեցինք համագործակցել Գերմանիայի եւ Ավստրիայի համալսարանների հետ, շատ ուրախ կլինենք, որ եթե դուք էլ որպես բավականին հայտնի ամբողջ աշխարհում մասնագետ միանաք մեր աշխատանքներին։ Շնորհակալություն։
Շնորհակալ ենք, մենք ուրախ ենք, ինչպես որ գնանք, բամ ենք եւ աշխատենք միասին, շատ ուրախ կլինենք։ Եվ գուզենք ես ասիլեր չի, առաջին անգամ 9 տարի է Ախբարը սոս ամսնացավ, Հայաստան 9 տարի եկա, ախր մենք բամը գա, ես 2013-ին աս տոպիկը խոսեցա Լոս Անջելես և անցյալ տարի Արգենտինինա մորոլես նույնը խոսեցա
Լսող չկա
Լսող կա,
բայց ակշին չկա
Առողջապահության համաշխարհային կազմակերպությանը
կոորդինատոր չկա,
ներդրող չկա, ներդրողը եթե լինի, այսինքն ինվեստորը եթե լինի, արդեն ինքնաբերաբար, բայց քանի որ մենք Հայաստանում մեջ արդեն սկսել ենք small business-ներով սպանվել եւ մեր տեխնոլոգիստներ պոլիտեխնիկից կամ EUA-ից, արդեն իսկ մեր երիտասարդները սկսել են ստարտափեր դնել այս թեմաների շուրջ։ Հիմա շատ հնարավորություններ կան։ Ես լավ տեղյակ եմ բժշկական կազմակերպություններից։
Դուք եք introduce yourself, որ մարդիկ
Ես Մերի Բողոսյան կամ ինչպես ասած Ռոբերտ Վերաչուի Բողոսյան American համալսարանի մեջ Entrepreneurship Innovation դասախոսն եմ Եվ մենք սովորացնում ենք innovation-ներ, այն ինչ որ խոսեցավ։
Մեն ասածներ innovation էլի։
Այո, մենք մեր երիտասարդները
Ձեզ կհրավիրեն կամպայման իրար հետ, որ ծանոթանաք մեր աշխատանքների հետ։
Եվ հրաչին քույրը դասետան շատ նշանավոր նորեն դիշկի է անկլիա։ Եվ շատ գուզե push this forward, բայց ես մեկ բան Rachis. Savalier nu kırkırkoynin adını var. Az mesramları bu diye mekmeçirav asak pamene.
Verçatseler taşıda. Verç.
İşte hima işte lessons to be learned. Lessons to be learned. Yani hima gadzirovis. Gadzirovis. Yani hima gadzim yerni buzegor pamene. Bayçem kidem. Yerni giyane. Argentina'yı. Zaten o seçiniyor.
Հիմա միջոցները տարբեր են, հենց այս օրերում մենք Սևանի մեջ ունենք Սևան Summit, որ տեղի կունենա եւ ստարտափները հանդերձ երրորդ ամբողջի վերաբերյալ են։ Ունենք շատ ինկուբատորներ, ինչպես որ խոսեցաք, մենք դասընթացներ Միևնույն ժամանակ պոլիտեխնիկան կան ինկուբատորներ։
Մեր աշխատողները մասնակցում են այդ Սևանի սամիթին։
Այո։ Ես այդ դասախոսներից մեկն եմ եղել Ամերիկյանից դուրս, մենք տարին 12 ամիս անընդհատ սեմինարների մեջ ենք մեր ստարտափների հետ, regardless։ Եվ կարող եմ ասել, որ ամեն խմբի մեջ, որ ինկուբատորներ կան, նրանց 75%-ը, գրեթե եթե 50-70%-ը health-ի վերաբերյալ։ Եվ մենք արդեն սկսել ենք աշխատել inter-departmental, inter-university level, մեր ուսանողները գնում են պոլիտեխնիկից գնում բժշկականը, բժշկականից գալիս են ամերիկյանը, այսինքն we're on the right track.
Yes. But you have to have the support of the government. Very important.
Հիմա արդեն սկսել ենք, մենք ունենք հիմա նոյեմբերի innovation conference, just innovation in different fields, որ պիտի տեղի ունենա, ժամանակ ես դուր կդամ դիզնովեր, այնպես որ we are, ունենք մինչև անգամ a startup product where it's been approved by Harvard professors. Now I'm looking for a market for it. The inventors are from Armenia, DDX. So we're doing a lot. We're doing, the more the diaspora Armenians come here and work within Armenia, the better it is, the faster we go.
To me, to say that it's time to bring MOFID to Armenia.
More ideas and more people.
MOFID should come to Armenia.
MOFID
Research and development of MOFID should come to Armenia.
MOFID
Mufid is because it's kidegince mufid. Arapayno yani useful.
Octagon. I see an octagon.
Octagon. That's one of the things. It's a starting thing. It could be an exemplar. Yes, ima morca այսօր գարտայի գոր մեկակները մեկ որ I mentioned imagine startup սկսան with I don't know, $500,000 or something. Then as by the way, very expensive startup-ները as ջոյի մեջ տիրուչին. Yani you have to start with an investor in order for you to push global. Բայց մեկակները որ let's see. That startup was bought up by global American company for I think $1 or $2 billion. In England, I forgot to tell you.
He's touching the issue. You should bring the research development of MOFID to Armenia, if you really mean it.
Yes, but the developer should not charge $100 per hour. That's another thing. I tried.
We're in the process of developing the venture capital market. We're talking multi-billion. we're in the process of developing angel investors for anything between 5,000 to 150,000. We're in the process of developing individual investors. As marketներ ամբողջը պետք է շտկվեն, որ մենք հասնենք այդ ինչ որ դուք ասեք։ Դրա համար ես ասի 5 տարի դուր։ 5 տարվա մեջ մենք այդ ամեն ինչը կարգադրվի, որովհետև արդեն իսկ թե from policies perspective, from government perspective, from research perspective, from the
Regulatory as well,
regulator,
regulatory
policy կողմը ես այն կողմից շատ տեղյակ չեմ տակավի։ Բայց մենք դա անելու համար 5 տարի մենք պետք ունենք, որ ձեզվես մարդիկ գան և Հայաստան ապրեն, իրենց հետ բերեն իրենց գործը և ոստներ աշխատցնեն մարդկանց։ Այո, մեր Հայաստանի մեջ չի կարող Հայաստանի մեջ աշխատող երիտասարդը չի կրնա այլևս low income-ով աշխատել։ It's not possible, որովհետև the living expense in Armenia is high. Yet the country is small, but our living expense is high. And we have an average of, average salary is around 250,000. Average salary. 250, I think, $500.